Ladies and gentlemen, I feel like saying good evening, but it's only 1 o'clock because it's so dark here. Welcome everyone. We do have a dark mood, sort of, that can lead you astray. I've prepared a review of innovation available on the market or is currently being tested. This is just a small part of what the world is offering from the point of view of a physiotherapist, but not only. Ladies and gentlemen, in Poland there's a whole range of long-term care services, which includes social care homes, daycare centers, home care. What's been really absorbing in the Polish system is that all these institutions are financed from two sources, by the healthcare system and social care system, or social support system, which generates a long list of challenges for clinicians, for managers, and for patients and carers, formal carers themselves. Implementing cutting-edge technologies to long-term care will open up many opportunities. And we have to consider, why do we want to use these new technologies in care? First of all, I'd like to improve the efficiency of what we're doing. The second pillar is availability of services. Like the speakers before me mentioned, more and more children are born, but somebody will have to do this job. So maybe the availability of some technological solutions could aid us and could facilitate access to various forms of therapy. One more important aspect is cost reduction. It's key to provide long-term care at a very high quality level. And we should ask ourselves, why do we want to implement innovation? Looking at statistics, you can see a diagram presenting demographic changes in Poland throughout the years. In 2050, 40% of Polish population will be elderly. So it's not a long time away, almost a half of society, which will require help systems, various institutions. Now, to provide the right care for the patient, we need a team, first of all, an interdisciplinary team, which consists obviously of a physician, nurse, but also a physiotherapist, dietitian, pharmacist, psychologist, therapist, and formal and informal carer or caregiver, who should also have a well-defined place in the system and support of our institution. Now, thinking about the role of the physiotherapist, as therapists, there's a whole list of tasks we have to perform to help our patients, to maintain the functions that remain, prevention, so as not to allow for further deterioration or disease, to slow down the domino effect, slow down the progress of the disease, tertiary prevention, alleviating pain. 80% of older people waking up feel pain, some kind of pain. So the pain often makes them inactive, maintaining and improving the quality of life, but also not allowing the patient to be institutionalized. Just like Professor mentioned before during the previous session, the best setting or environment for the person is their own home. So I'd like to present the innovative solutions we could implement, or which will be implemented, thinking positive about this, so as to prevent institutionalization, or to facilitate our work as physicians, to facilitate therapy of the patient.
Jeżeli myślimy o
When we think about the physiotherapy of the future, we have a slide showing what this physiotherapy of the future can look like. And here we are talking about telemedicine, remote therapy, wearable devices, bands that are used in the system, virtual or augmented reality, robotics, artificial intelligence that Professor Duch discussed yesterday. But we can also have 3D printed ortheses. And let me start with robotics. We usually think about exoskeletons, allowing patients with various disorders to perform various movements. And I would like to share an article, a paper that was published recently about a soft glove. It helps the patient to maintain the hand grip. The study was focused on patients with various hand or palm disorders. They received such a glove for 6 weeks, and they were able to use it every day to assist them with daily functions and daily activities. And after the 6 weeks, once the patient was examined, the hand grip strength increased. So after relevant training by the physiotherapist, the patients were able to use these gloves independently at home. And although there was no indication of the minimum time that they have to use the glove for, it was about an hour a day. And it is quite a lot for such type of assistance. And there was a good response from patients, measurable effects demonstrated in improved hand grip strength. Another example that I would like to present to you is a pneumatic exoskeleton of the hand. There are gloves on both hands of the patient, and when they bend the fingers in the healthy hand, the other affected hand performs the same movement. There is a video here, so you can see what it looks like. So, with this mirror movements, the patient bends and straightens the healthy hand and thus stimulates the same movement in the affected or impaired hand. And it creates great effects because it creates and enables motor pathways. And the patients were very happy to use this equipment at home. Another innovation, another novelty, is a paper published in 2021 in the Netherlands. And here it focused on people with shoulder impairment, shoulder disorders. So with regard to shoulder problems and the work of physiotherapists, often movement with painful shoulder causes a problem with spraining the rotator muscle. So here we can see how a robot can learn the movement that should not be performed. It was a short study, a small study, but the final result of it was presenting a model of trajectory of movement that minimizes the load or the burden on the muscles. So such research can be a basis for development of future safe robots for patients with shoulder problems or with affected shoulders. Another novelty is the monitoring of patients, something that is increasing its importance in our medical world. I would like to show you a study from Australia. The study covered patients with acute coronary disorders or with heart failure. So there's a huge risk for these patients, there's a huge risk of readmission. And these devices measured body weight, measured activity, heart rate, and they also provided feedback to the caregiver. And in emergency situations, there was an alert sent to the alert or notification center. The whole study covered 164 people, half of them in the control group, half of them in the intervention group. And over the first 30 days, there were no differences between the control and the intervention group, which was slightly demotivating for the researchers. But it was proven that within 6 months of patients wearing those wristbands, in the intervention group, there was a significantly lower hospital readmission rate, of course, unplanned readmission rate, and the patient more closely followed the doctor's and therapeutical recommendations. So the researchers also presented the costs of these solutions, and it was calculated that if 500 patients were covered by this equipment, it could help save 100,000 Australian dollars per year. It is about 70,000 US dollars. So another thing that I would like to share with you is that in our province, in our region of Poland, we are introducing a program called Telecare in Kujawsko-Pomorskie province. It is a program that I'm taking part in together with Professor Borkowska, who is in the audience. We are currently building the foundations of this project. But I would like to share with you something very important, something I think quite innovative. Of course, we have preliminary screening, audit, nursing audit, cognitive audit. But one thing that makes our project stand out is that we have involved students into performing the audits. Students of medical studies and health studies, third year of nursing studies, fifth year of therapist studies, they're almost ready to start working. And we implemented Scandinavian practices, where students of the final years of their university courses, they perform certain procedures and they are involved in screening programs. And with the shortage of workforce, of personnel, can be a great solution to implement such schemes. Rehabilitation using VR. There's quite a lot of software available, but I found a news piece at Plus One about the opinion of patients, or feedback from patients towards this type of treatment. The study was carried out in a long-term care facility in Canada. Patients described this therapy as pleasant, exciting, innovative, bringing cognitive and social benefits, and they were more motivated. This is Canadian research, and of course the cultural aspect is of great importance here. I personally had the opportunity to work with a project using VR tools, and the responses were very positive. But in the beginning we had to overcome the barrier of it being something new. But once this barrier was overcome, we had a very positive response. Augmented reality. Augmented reality also becomes an increasing part of treatment systems. And I would like to show you a system that is called My Daily Routine, where patients wear goggles. They can see their environment, their close vicinity, but there is an additional image displayed on the goggles. So this personalization of the goggles and the image displayed is done by the caregiver. So if our patient looks towards the door of the toilet, then a message will display, this is the toilet, you can go to the toilet. Or if they turn around and they look at a specific person, the goggles will display an image or play a sound. This is your son, Adam. Of course, this is something very innovative. But looking at the developments in technology, perhaps not for today's seniors, but maybe in 20 years from now, it will be a norm, it will be a standard. Yet another tool is telerehabilitation or remote physiotherapy. It gives us customized and individualized therapeutic sessions, remote sessions. So we had a study with telerehabilitation, people with knee impairment, a large group of 38 people. And this rehabilitation group was compared with the control group who received a leaflet. And we can assume that if someone treats online with a physiotherapist, it will get better. But in science, we need evidence in order to be able to implement it. So perhaps it is a solution to fill the blank spaces in access to various benefits and to various services, but we need good or excellent internet connection for that. Another study, a very similar one, compared the importance and the role of telerehabilitation, but here there was a comparison between patients undergoing in-person physiotherapy and online physiotherapy or rehabilitation. And here it was a huge surprise, because in the control group and in the intervention group, of course, there was improvement in both groups, but there were no significant differences between the groups. Maybe it was a result of the fact that the patients were very motivated to take part in the physiotherapy. And now a bit of primary prophylaxis or prevention. In Australia, a platform for remote rehabilitation was developed. It is not online rehabilitation. It's not patients taking part in online real-time sessions. They had an application where they could use the system at any chosen time of the day. It was a large study with 500 people, and it was a study covering people aged 70 and above. And the most important indicator was whether these patients experienced a reduced number of falls in the past year. So after a year of study, it turned out it didn't make a difference whether they trained or not. But the study was continued afterwards, and a long-term effect was demonstrated. So over the period of 2 years, these effects appeared over time. And it was proven that 20 minutes of training while standing per day reduces the risk of falling by 20%. But it was a 2-year follow-up period. As for physiotherapy, we as physiotherapists, in order to be smart, we need to have measurable, tangible results, effects. And this measurability should be expressed in figures. So one of the proposed solutions is using an app, a mobile app, to analyze the posture of our patients. So there was an app used by physiotherapists to assess the patients. There was a number of physiotherapists with various experiences, and they assessed the same patients, as I understand. They assessed the points of posture, and in this study, it was demonstrated that such a platform, that the results were almost identical between various physiotherapists. So when the patient moved from one physiotherapist to another, because there is rotation between physiotherapists, these results were comparable, and we can call these results almost objective. We also have personalization of care using artificial intelligence. There were studies where patients' history, interviews, details about the pain they are suffering were introduced into the system, and the information about previous treatments. And the artificial intelligence algorithm, based on machine learning and based on the information provided, it proposed the treatment, and that treatment was really effective. And it can be used as support for physiotherapists. And now coming to the end, here you have a chart indicating social development and the population, global population, with reference to important events in the history of mankind. We can see this exponential development. You can think about your own mobile phones 20 years ago. I checked myself that in 2004 the most popular mobile phone was Nokia 3210. So you can imagine what will come in 20 years from now. And the development of technology in the future is not just about developing the tools, but it is also the change of our own perception of the world. Every innovation brings new possibilities, new challenges, both ethical and social. And we have quite a lot of these challenges. I can see that I'm running out of time, but we have a system that is too complex, too fragmented. We have a lot of legal issues. An example for physiotherapists is that requirements for rehabilitation centers, we need special equipment, and these requirements did not change for 20 years. How are we supposed to innovate? And we have to use regulations from 20 years ago. There's new recommendations for home care, home physiotherapy, that prevents the patient from admission to an institution. Personnel. We need to change the teaching standards. Just one more minute, half a minute. Personnel, society, building trust. But I would like to finish on a positive note. What should the long-term care of the future be? I wondered about that myself, and three things came to my mind. Whole person, it should be inclusive, available for all groups, and it should be networked. And by coincidence, these words create an acronym, meaning we will overcome the challenges and we will win. Thank you very much.